Hello friends, welcome to our channel Life Spurthy. Dr. Prakash, today we are going to have one exciting subject for discussion. How are you doing this day?
Yeah, good.
Yeah. Prakash, I've been hearing a lot of questionnaires from various people. They start saying that I have some gastric, I have some problem. I'm tensed, I'm stressed. I don't know. I had a big booze yesterday and I have some pain in my stomach. Okay, these sort of questions regularly we do get as doctors. Okay, when they say this, probably they're talking about gastric ulcer. That's what I mean as a medical man. So let us take these vague words: gastric trouble, peptic ulcer, gastric ulcer, duodenal ulcer, all those things. Put it in a nutshell and let us discuss pain around the upper abdomen, epigastric region. Okay. So now, you being a general surgeon, probably you would have seen a lot of cases of this.
Yes.
So how do you address when somebody comes to you with this vague problem? Because they don't know really what they're going to. And sometimes people say that I had a gastric, I had a big booze yesterday, and next day I had a heart attack and I've already traveled. Okay. This is a common questionnaires we see. How do you address this?
See, Dr. Ashok, thank you. See, basically, gastric ulcer or gastritis or peptic ulcer or duodenal ulcer, these are all the synonyms. Causes pain in the upper part of the abdomen. That is the epigastric region. This region, they'll have pain and sometimes they'll have vomiting, nausea and symptoms like that. This is basically due to increased acid content in the stomach. That is gastric juice, whatever, hydrochloric acid, whatever we say, when it is increases, so there is the irritation of the stomach. Stomach get irritated, and in the beginning there will be minute, small ulcers, small specks like thing. That is called gastritis. So when you are doing repeatedly same thing, same kind of food habits and the alcohol, what you were told, and smoking and junk food, all these things. When you have
Dr. Prakash, when you say acid, let us know why this acid is needed. What is this acid? There is a reason for everything in human engineering. What God created this body, the machine, there is a reason for everything. You said there is a production of acid. Okay. So people may take acid, something burning sulfuric acid. Okay. They may think in those lines. So let us come to that point and explain a bit about acid. Why this acid is needed for us. What is it?
No, basically,
how does it work?
Yeah. Our stomach secrete hydrochloric acid. Hydrochloric acid, which maintains the pH for the digestion of the food. Now, whatever food we take inside, it has to get digested. Then it has to go to the blood. So, for that process, for digestion process, hydrochloric acid very much essential. Whatever the enzymes were secreted by the stomach, pancreas and liver, so they have to digest the food. For that, acid maintains it liquefies the food, make it into a gel-like thing, and that enzymes will come and act, that will divide into energy, that will be converted into. So this is acid is a prerequisite for digestion and to food to get absorbed into the body and maintain our energy.
Okay, shall we put this way for our viewers? See, when we consume food, we consume solid and semi-solid, that sort of thing. Non-vegetarians, we take little tougher food also. All these things can be grounded somewhere. It has to be grind somewhere, right? It has to be break down into smaller particles, make it into a paste where it can be absorbed through the various cells and tracts along from your esophagus down to stomach and then duodenum,
small intestine and the rectum,
and then goes down. Okay. So this solution is needed to break down these particles, which is solid or semi-solid, into minute particles, amalgamate and then make it easy for absorption. So a solution called as hydrochloric acid, which is strong enough to break this, is enough needed for us. That is how God has created this to produce acid, and that acid is needed for the digestion breakdown. So now,
just when you want to have a thought, say I want to have a food, that itself stimulates your brain.
Okay.
From that stimulation, there will be secretion of acid. When you think of food, there will be secretion of hydrogen. If you don't take that time, the acid increases and it will damage the stomach. And sometimes because of stress, So your adrenaline secretion in your body increases and you are sleepless, you are restless, you are irritable. There is a lot of secretion of acid and you are not taking enough food to dilute that acid.
Okay.
Then that acid damages the mucosa of the stomach.
Okay.
So when mucosa gets them, that is called gastritis in the beginning and later it is called ulcer.
Okay, let us make it little more simple for the people. You have an acid in your stomach which is needed for you, necessity for your life, for the food to be get digested. Now the question is, between use and abuse and overuse and misuse, okay, there's a balance. Okay.
Yeah.
The day you have more acid and you don't have anything there for it to digest or break down, it will start breaking down your own system. That is called as your mucosa.
Yeah.
Mucosa will be broken down in pieces. So it will happen over a period of time slowly and then finally they get into ulcer.
Ulcer.
When you have an ulcer, naturally it pains. Is that?
Yeah, that's what.
Yeah.
If it is in the stomach, it's called gastric ulcer.
Yes.
If it is in the duodenum, it
It's
is
a
called
duodenal
duodenal
ulcer.
ulcer.
Peptic
Sometimes
ulcer.
most of the duodenal ulcer get perforated.
Yeah.
So that's why duodenal ulcers are more important than the gastric ulcer. Duodenal ulcer prone to get perforated and it can cause lot of perforation, can cause peritonitis and further complications.
Okay, now what are the causes for this gastritis or peptic ulcer, duodenal ulcer, whatever it is? What are the causes?
See, causes, it depends again on the food habits. Basically, if we want to, rather than going in detail, if you want to make our viewers to understand, see, food habits, we must always avoid spicy and chilly, basically, which increases the content of gastric acid secretion. So then you can avoid these junk foods, these chips, wafers, biscuits and all these things.
Okay.
They, because of their fried foods, they increase the secretion of the acid. So you can avoid those things. You can have a lot of fruits. And when once fruits, they can actually, they will not increase the secretion of acid and they can neutralize, like say for example, banana, apple. So they, since they are semi-solid like thing, they'll immediately neutralize.
So
now what we give as antacid, see, when there is a secretion of acid.
We will come to the treatment part later. Okay, let us make this clear for the people. The causes for gastritis. You said one, any food which irritates your stomach produces more liquid, that is hydrochloric acid. More hydrochloric acid, more ulcer, you get gastric pain. So what are those food which increases the acid production? One, you said any sort of spice, you said, that is one. Okay.
Chili, spice and chili.
Any spice, that is one family.
Okay.
Any spice is one irritant. What else?
See, then you have junk food. See, which most of the fried foods, fried items, they will increase the secretion of acid.
Okay.
So this is a study. Actually.
Okay, junk food, fried food, and then irritants, masala, kara, all those stuff.
Then food habits.
Then what next?
Food habits, taking at a particular time. See, because you are used to take at breakfast this morning, say for example 8 o'clock, lunch at 1:30 at 2 o'clock, and dinner at 8 o'clock.
Okay.
So there is a automatically cycle in your body.
So what you are meaning to say is there is a periodicity which is maintained within our body. That rhythmic status should not be disturbed. Your body is trained to produce acid at a particular time. At that time, there should be food to eat. Otherwise, it will eat you.
Eat.
I think that is clear to the viewers.
That is. So having a food at particular time is very important.
Okay. So we have mentioned 3 causes now: periodicity of food, junk food, and kara masala, that sort of irritant. What else?
So another one is stress. So when we are very much stressed.
I wanted you to say this. Yes.
Stress. And see, whenever there is increase of stress, there are a lot of chemicals in, say for example, adrenaline, which increases your heart rate, which in turn increases the acid secretion also.
Okay.
So when that time there is no food, it will again eat the stomach mucosa. So stress, how to handle the stress is very important.
Okay.
So if you can
handle another cause is stress. Let us go one by one. Stress is another cause. Stress could be anything. Okay. That could be mental stress or extreme physical stress.
Or emotional
stress, it could be bodily, emotionally, anything. So stress is another aspect. Anything else, particularly younger generation we have, you want to say something which is more common in youngsters?
So sedentary lifestyle again. You have proper exercises and proper time to wake up And if you always watching TV and all those things, these are the lifestyles which in turn causes again
the rhythmical pattern or periodicity is gone and they're getting stress. So we spoke about that. So let us go a little further. Now people with various habits, smoking is a fab every day.
Smoking, alcohol.
Okay. You can see on all the corners everybody having a fab. Okay, it's a fab today. Okay. Having a fag is a fab. Okay. And then alcohol
It
has
become a fashion.
Alcohol has become a social drink. So how much of contribution of alcohol and then smoking on ulcers?
There is a new entity called alcoholic gastritis. So most of the people, youngsters, are taking alcohol and smoke. So there is a new entity developed. We are seeing a lot of cases like that.
Okay.
Because they will consume a lot of alcohol, they will not eat properly. Again, there is a increased secretion.
What could be the percentage?
Percentage maybe around 20 to 30% in young individuals. We are seeing now.
If you list 1, 2, 3, what is the major cause? Is it smoking and then drinking is the major cause for ulcer?
Yeah, these are all the contributing cause.
Okay.
There is no enough statistical data to give the exact percentage.
Okay.
So say around 1/3 of the people, young people, they are suffering this gastritis.
Okay.
So see, all these problems, they contribute to your health.
Okay.
So how we can come across this? That is very important.
Okay, you made it clear now. N number of causes for gastritis. Now let us delve into the another aspect of it. You know the cause. Okay. Now, how a common man should identify he has a problem? What are the symptoms?
Symptoms like he'll have in the bloating sensation in the initially, because of indigestion. Because there is a food when he is not getting digested properly, there will be bloating sensation. That is the main starting symptom. Then you will have burning sensation. Burning sensation in the upper stomach. That is develops when there is a gastritis. Then you will have severe pricking sensation when there is a development of ulcer. So ulcer is very deep, then there will be pricking sensations. Then they will have vomiting. Vomiting or nausea. You feel like vomiting sometimes, that is called nausea. And then they will have vomiting sensations. Then they will have sometimes, some people, duodenal ulcers, they will have back pain also.
Okay, my specific question is, these are all vague symptoms, everybody ever comes. How specifically this is differentiated from heart attack?
See, heart attack,
the pain is almost similar.
Sometimes some of the referred pain will go to the chest, some of the cases. See, how specifically when we are only with experience only differentiate. It's very difficult to differentiate when an individual having a cardiac pain or a gastric pain by doing ECG, and with experience. And with a lot of investigations only we can.
So essentially what we can say to our viewers is, saying that it is simple gastritis, I had something and I have a pain, take one pop-up, one Prantac, Pantadoc, this sort of stuff and then sit at home. Instead of that, visit a doctor. Okay. You are missing sometimes maybe a cardiac arrest. Don't take it that easy and simple with a peptic ulcer.
Ulcer or gastritis.
So meet a doctor who is educated enough to make a differentiation between two things and take a call on that. That can save your life. So probably that's one thing I wanted you to tell them.
That's what. See, don't take decisions and don't take go to medical shop and take Rantac, Pantap, all these medicines by yourself. Consult a doctor, gastroenterologist, surgeon, and you can take a suitable advice, do suitable investigation, take the treatment accordingly. Then what are the solutions we have for this?
Yes.
See, solutions proper. See, homemade food is the first solution. Don't try to eat every time outside food, so which are very much fried and because of they add a lot of ingredients which are not required. Naturality is lost. When the naturality is lost, again there is an increase in the secretion of acid. Then avoid alcohol, smoking. This is very difficult to do for youngsters. So this is one of the suggestion. So, and avoid stress. Where we can reduce the stress, practice some regular exercises, yoga, meditation, pranayama, which will calm down your body. By calming down, we can reduce the secretion of acid, which is not required. Acid is required during digestion only, not always.
Acid is needed to eat the food, not to eat your mucosa.
So like that. So then, If you visit a doctor, there are a lot of investigations like endoscopy we can do, and what is the disease we can diagnose and treat accordingly. Basically, these gastric ulcers or a peptic ulcer require about 4 to 6 weeks of antacid and PPI, proton pump inhibitors. So what we call as pantoprazole, omeprazole, all these things.
The family.
So you should take it regularly. And the other problem is they will make it irregular. They will take for 3-4 days, and the pain comes down, they will stop it. So the complete problem is not solved. Ulcer will be there, but pain will come down. But again, that ulcer will recur and it will cause a problem.
Okay.
Some of the peptic ulcer can become even malignant also, like they can become cancer. Gastric ulcer are supposed to be, most of the ulcers they go for, if not treated properly,
They're prone to go into malignancy.
cancer,
Yeah.
whatever cancer or you tell. So if you follow all these things and diet and all these things, medicines and all these things,
Okay.
so you can control all these things and you can stay away from peptic ulcer and live
I'll
happily.
pose a question now. From the viewer's side, I'll pose a question now. Okay. My habits are quite neat. I don't take alcohol. I don't smoke. I don't eat anywhere. I eat at home only. Everything, I'm ideal person. But
Okay.
still, I have gastric ulcer.
So
What
this
the
is,
solution for me?
see, this is, I told you, no, it is because of emotional well-being again. So once you are emotionally not balanced, even with all these habits, so because of emotions, there will be a lot of chemicals in your body which will induce secretion of acid again and damage the gastric mucosa and it will
So
cause.
that's where I was trying to tell viewers. There's something called as type A personality. Type A personalities can get into gastritis even without having all this list of causes. The personality itself can be dangerous to them. Who are these type A personalities? Like say highly educated people and into executive jobs or top CEOs or maybe even doctors or lawyers. People who are in the higher strata, these are all type A personalities. There's also an element called as suspicion. These people are very suspicious. Okay, don't believe certain things. Okay, they're strong on the issues. Emotional quotient is little disturbed here.
And
These type A
data
personalities-
driven.
Yes, this type A personalities, obsessive, repetitive, and highly stressful jobs, those who are in that area can get into gastric ulcer or peptic ulcer even without all this list. So that is very important. That is where our emotional quotient is important. That is where we need to balance our mind and body, and then our circumstances. Essentially, it is environment. We have to live with people. We have to live rightly. Living rightly is the main way we can avoid having an ulcer. Another aspect I wanted to ask is, in spite of everything being all right, still people get H. pylori.
H. pylori is one of the
little enlightenment on that to our viewers. H. pylori, which is not related to any of these things. If you are infected, this is a new element.
It's called
There are
H.
some
pylori.
people who can get infected by this thing called as H. pylori. If they are infected by H. pylori, they can get
They
into
can have
gastritis.
gastritis.
In spite of being all tick marks right everywhere, they can get into. That can be treated very well by doing a gastroscope, that is called as endoscopy.
And
And
there
they'll
are
take the
medicine.
material from there, they send it to lab, identify the H. pylori, and you have medication.
Treat medication.
You can
for
tell
H.
about that kit.
Yeah, H. pylori kit available.
Yeah.
You
How
have
it
to-
works, we can explain that.
See, basically it's a combination of 3 drugs. So where it will remit the infection, kills the H. pylori bacteria, and then there will be reduction in the acid secretion,
So-
and it provides a smooth this thing. So there you have to take 3 tablets in the morning and 3 tablets in the evening for a continuous 7 days.
Yes. So that is where one side acid will be production will be reduced by using pantoprazole, all those things. Another side there will be antibiotic in that. That antibiotic will tackle H. pylori. So one side H. pylori is tackled. Another side acid production will be reduced, and this will be sustained for a periodicity of time. When the ulcer completely heals, then this patient will be shifted back to regular diet, normal diet, and go on with the life. Okay. What are the major complications?
See, major, I told you, no, because of that repeated vomiting you have, which will have trouble. You can't do your work comfortably, daily routine will be exhausted because of this problem. Then you have gastric ulcers can become cancerous changes. most of the common this thing. Gastric ulcer become gastric carcinoma, cancer. Then you
Yes.
have all these cancer related problems.
Major issues related to that.
Then you have a duodenal ulcer. Duodenal ulcer can perforate and cause peritonitis, can cause death. We are
Yes,
seeing more.
that's another important aspect I want
We
you
are
to
seeing
bring.
more than 15,000 deaths in
Yes,
India
out of
out
this
of
complication.
per year.
Yeah.
Even world it is more than 20 lakhs deaths we are seeing because of peptic ulcer perforation. Earlier it was more because of these drugs, ranitidine, famotidine, and then omeprazole, pantoprazole. It has come down, but still it is there.
Okay.
So all these things they have to follow, and they can have their healthy lifestyle, and they can live happily.
Okay, friends, at the end of it, gastric ulcer, gastritis, peptic ulcer, whatever it is, gas trouble, this is once again a lifestyle disease. It is brought by us, okay, which can be tackled very well by understanding the disease pattern, the ways, whatever has been explained or discussed here. Moderate your life in sense of taking proper diet, avoid from certain food and habits, get into good exercises, get into emotional well-being, get into the society environment which can create a good environment for you to get out of the stress. With all this combination, what happens is you stay away from the disease. Even if you're already getting it, you have a means to get out of it. And after saying all these things, there is an element called as medical treatment. In the medical treatment, we have certain medications to reduce this thing. It's well established. If it is H. pylori, we have medication
H.
kit.
pylori kit.
And if any other issues, we can do an endoscopy and diagnose whether you have a peptic ulcer or you have a cancer, or maybe whether it is going for anything else, we can identify it and it can be better treated. Don't neglect it saying that it is ulcer. There may be sometimes cardiac arrest which can mimic the symptoms. So this is what we wanted to give you takeaway message to our viewers. Thank you for watching, viewers. Welcome. Come back again and watch our live Spurthy again and again. We are here for you. Thank you.
Thank you.